News, keep you guys on your toes here. First time here in the Civic Center for one of these. We thought it was just important that we continue to brief the community on where we are in response to the latest threat in the COVID process with the Delta variant. Again, just some basic principles that we've established as a community going through this over the last 2 years almost. This has always been about preserving our medical infrastructure to take care of our sick, to protect our most vulnerable in the community, and to find a balance in living with this threat. And again, the tools that we've developed and what we've learned is our greatest tool is the vaccine, a modern day medical miracle. Targeted mitigation, currently things that we know have worked or helped when the threat gets too hot, and testing, the basic testing to identify the virus so we can quarantine and isolate that risk to the rest of the community. I think I'm going to go through some of the data points, and then we'll go through some of the initiatives and then take some questions. Fortunately, over the weekend, we did not have any new deaths, so that's very positive news. When we look at the reporting of cases, I'll report out on Saturdays, Sundays, and today's. Saturday was a high case load throughout New York State. We were no exception to that. There was 90 cases on Saturday. Sunday, we had 61 cases, and today we have 57 cases. When we look at hospitalizations, reminder, on Mondays, hospital numbers are always a little bit higher because you don't discharge folks as much over the weekend, but we have seen a small uptick in hospital numbers with the level of new transmission. We now have 29 residents in the hospital, and we have 8 residents in the ICU, so hopefully we want to keep them in our thoughts and prayers to get well and get home to their families. When we look at the vaccine, as a reminder, we have a clinic tomorrow here at the Civic Center where we're vaccinating. There's also other vaccinations. The fairgrounds, they're still vaccinating, pharmacies. Dr. Gupta's team has been getting contacted by primary care providers, and then we distribute the vaccine there as well. So certainly we need everybody in the community to get vaccinated. It's your best chance of not getting COVID. It is our best tool when you get COVID to have a good outcome with the virus and prevent yourself from spending time in a hospital and or worse. In addition to that, it's our best tool to continue to live with this virus the way we have. I know we'll talk about schools moving forward, but it's important that folks realize how disruptive this virus can be in schools. And the vaccine, if you're vaccinated, your health is fine, but also on a quarantine, you're not in a quarantine for 10 days either. So keep that in the back of your mind as well. Testing, today I believe we have testing here at the Civic Center by appointment. On Thursday, we'll be doing rapid testing at the Fayetteville Town Hall. Please go on our website, ongov.net, and register for that. But again, we know that finding the virus, wherever it is what we need to do. And then we need to isolate that threat, and that's what we're doing. In the absence of the New York State Emergency Declaration, more policy making rests here at the local level. And just so everybody, it's worth repeating, we factor in many factors into all of this. The data and the advice that Dr. Gupta and her team gives us. What are our vaccination rates? Where are our hospital numbers? Key metric. Where are the ICU numbers? Key metric. What are the trends we're seeing related to positive rates and whatnot? These are all factored in when we make policies. What does contact tracing tell us? Because broad-based mandates have to be enforced. And if you can't enforce them, and there's no need to enforce certain mandates, it's important that we remember that. So contact tracing is a critical tool. We remember the zones, orange zone, red zone, yellow zone. Those zones were an abysmal failure and did not work whatsoever. So we've learned all this in the pandemic. So now this is what we're looking at on a daily basis, really multi-times a day, to look at what are some mitigation strategies we can use. With this, we've always talked about our vulnerable. That's why we've made mask mandates mandatory in not just nursing homes and assisted living facilities, but independent living facilities. That's why we have highly recommended mask wearing for our seniors and those who have immunocompromised illnesses when they're out in the public as well. We are reinstating the quarantine if you're symptomatic while waiting for a test result. We did this in the beginning. What does that mean? That means if I am sick and I have COVID symptoms and I get a test and I'm waiting for that result to come back, you are now in a quarantine. We're doing that because based off of data, folks are not doing that and then they are spreading the virus. This happened very early on in the pandemic. Related to school guidance, we will have school guidance out to districts later this week, and it will be guidance. And our team in the health department in our work with the school districts are working very closely on that. And it will be comprehensive, it will be very thoughtful, and it will answer all the questions that people have in the community. And we can talk a little bit more about that. When we look at some of the issues where we're looking at targeted mitigation, and we're in masks in this building now as employers. Each employer has the right to put in mitigation efforts with mask wearing. Why? Because it impacts our workforce. We're a large employer, we have people come in who may be COVID positive, that spreads potentially to other departments. Those departments are frontline professionals that we need working on response and recovery here. So I made the decision, with the help of Dr. Gupta's encouragement, that we were going to do masks inside the Civic Center in county facilities and temperature checks again. That's risk mitigation for our operation. At the same time, that will help the public as well, but that decision was made because we have an operation to run every day, and as the CEO of that operation, it's best for our workforce and for the services we perform to put these mitigation levels in. I have talked to the state about the fair and about other Syracuse University about large gatherings. We're working on guidance for large gatherings and have shared concerns, and certainly we'll work as teammates to make sure that proper mitigation is put forward based off of the data on the ground. But those are conversations that we are having, and there may be more to come on that in the near future. Saying that, we will be putting in a policy for new hires that they need to be vaccinated in Onondaga County. This is not a mandate. Nobody says you have to come work for Onondaga County, but at this point in time, if you do want a job here, and we have many job openings, you will need to be vaccinated. At this point, we are very close to hitting a very nice goal in our community with 300,000 residents being vaccinated with at least one dose. We hopefully will get to that milestone this week, and we're excited about that. Because that is the tool. That's the tool that's going to keep us going. It's going to keep our economy going. It's going to keep us getting our kids for in-person learning for a full school year. I was very proud of the work that everybody did in this community for the in-person learning at the end of last year's school year and the partnership that we established. Saying that, I'm going to have Dr. Gupta come up here now and talk more about the science behind what we're facing, the challenge we're facing, and the threat we're facing, and to remind people of the rules related to quarantines. And specifically, this is a big deal if you're vaccinated, because if you're vaccinated, the rules are a lot less than if you're unvaccinated. Doctor, do you want to come on up?
Good afternoon. So a lot has changed since I stood here in the other side, actually, and we saw the lowest number of cases in June. In fact, June 27th, we had one case. 4th of July came, 4 or 5 weeks down the road, we were quite concerned about the Delta variants, and then we started to see rise in cases at this point. So I thought, as County Executive has mentioned, as I would describe some of the things which we are dealing with from the science basis. What is the variant? A lot of times there are confusion when we talk about vaccination and how the mitigation processes which are put in place are going to actually impact how the variants come to our community. So what are variants, and can we stop them coming here, and how? So SARS-CoV-2, as you know, the virus causes COVID-19, continue to replicate. It means continue to divide over time, and to other, similar to any virus, this is a normal process. And the virus enters our body, it makes billions of copies actually, or trillions at times, process known as replication. And why? Because it's need enough quantity to infect not only us, our every organ system, but also to give infection to others when we are talking to them, when we are interacting with them. So during these virus replication, you can think of the manufacturing. Even in the machine manufacturing, there are defective products, right? You have those things which are not perfect. The same thing happens in virus replication, that you get millions, billions, trillions of copies, and during those productions, you are going to have defective virus. So some of the viruses who are defective don't have much implications. They are not that infective. They don't have that much problems, they die out, while some become more prominent. And that's what you started to see when you saw alpha, beta, gamma, and then now delta, and then lambda, and other ones are coming. So delta is the most prominent at this point. And what happens that the sequence of the way the virus genomic sequence sort of flips. If there are 4 things, ACGU, that's called adenine, cytosine, guanine, and uracil, they flip their sequences, and then you have the defective virus. And not trying to give you a science lesson, but that's a reality. The more the virus replicates, because it provides opportunity, it is provided by, because if people are unvaccinated in the community, that provides more base for them to replicate. The more production of virus, the more opportunity for variants to come to our community. So we are concerned at this point that, like any other community, that we have mutant virus are impacting our community, which have high transmission. It means they can spread more easily, and then they can cause more severe disease. And when that happens, then we end up seeing the exponential rise in cases. If you remember, in last 3 weeks, our cases has gone up significantly. So virus is very smart and outsmarting us. So what can we do? Get vaccinated, that's the one thing. Immediate response. It will not only save lives, but also protect those who actually, especially the kids, who cannot get the vaccine. And those who are immunocompromised, whose immune response is not robust, that will be important for them to get that protection. We are, at least where we can say that stopping the new strain in the long-term strategy to stop the pandemic, if more people are vaccinated, it will deny opportunity for virus to come to our community that way and to continue to mutate. So this is part of the mutation of the virus and the Delta variant. The other reminder for the isolation and quarantine. We have many people who are vaccinated. Thank you to those who have been putting their arms out and getting vaccinated. I would encourage everybody to do that. So if those people who are vaccinated and become cases, they have minimal symptoms, or they can be asymptomatic, they still have to be isolated because they can still transmit the infection, especially with the Delta variant that has been proven by case study in Massachusetts. You saw in Cape Cod, the many people who were vaccinated, they actually continue to transmit, and there was an outbreak there. However, if you are vaccinated and you are exposed to somebody, then the quarantine gets impacted. So you don't have to be quarantined, but if you become symptomatic, and depend on your workplace, that also is important. Or if you have symptoms after the exposure, you will have to be put in quarantine for 10 days, which is a standard. Because of the high community transmission, we say put the face covering for 14 days. That's a CDC guidance. There is another way out of that is if you get the testing between 3 to 5 days, you can test out. So that's if you are vaccinated. If you're not vaccinated, you're going to have the same 10 days of quarantine. And if you're a healthcare professional, that applies a little bit different also from there, and it depends on the employer. So we as employer, if I'm thinking if somebody is in the health department, depending on where they work, I'm going to look if my person is exposed to someone in their household, how close contact, then we can decide should we have them work from home, not come. That will be our discretion at that point. So those things are pretty much case by case basis if they're vaccinated. If they're unvaccinated, the same things applies as before. So isolation and quarantine orders are still in the process. They have never gone away. We were hoping they will disappear, but they did not, and they're back in the play at this point. So if you know somebody who have been exposed, or if you have been exposed to, please follow those guidelines. That is important to reduce the spread of transmission in our community. And if I'll be happy to answer any questions. Thank you.
Okay, questions?
County Executive, both the Mayor of Syracuse and the Mayor of Salt Lake have expressed a great deal of concern about the state fair as it stands with the way that the numbers are going. Are you taking those same sort of concerns to the state at the moment, and what does that conversation look like?
Yeah, so we're having a conversation, right? And so we have in our mind some mitigation ideas that can help with that, and we're having those discussions. And we have the ability to implement those mitigations. So we're having those discussions, and I think at the end of the day, we'll take a look at where the risk is and what mitigation we can implement to help slow down some of that potential risk.
Are you talking about mitigation everywhere outside of the fairgrounds, or?
No, we're talking about the event, right? So the fair is an important event for the community, and at the same time, there's some things we can do to make it potentially a little bit safer. And so we're having those discussions. Mind you, with COVID, right now we're on a little bit of the Delta roller coaster. And if you look at, various epidemiologists modeling of this, it looks like we could have another 2 weeks of shaky cases, and then it starts to flatten out and starts to go the other way. So these are all things that if things are still where they are today, we're going to work with the fair and ask them to implement some mitigation that we're having those discussions on. If things change and they've improved, and the risk that is there today is not there in 2 weeks, then that's different. But we're having those discussions.
With those discussions, how early could we see some sort of a change? And are you able to guarantee that we'll see something to try to curb a potential outbreak here?
Well, we have the ability to make the decision ourselves if we have to, but we're working with the state on that right now.
So do you have final say? Does the county have final say on the state fair, or does it still?
Yeah, right now it's the state fair is their property, it's their event, but if we believe that there's an accelerated public health risk, certainly under our emergency orders, we can do something about that. But again, we're having very good conversations with the state. I don't think there's zero friction between us and the state on this.
This question can be for either the county executive or Dr. Gupta, but do we know how many vaccinated people in the county have contracted COVID-19, and do you think that's important information to share?
We do know. I don't think we have that number now, but we do know that number. Yeah, and it's changed, right? In the beginning of the process, when you didn't have the Delta variant, I think the percentage, I knew the percentage of vaccinated, right? You probably had, for example, I believe it was like 280,000 people were vaccinated at the time, and 200-something people were a breakthrough case. So you divide the 200 by the 280, it's like 0.011. Now, the Delta variant, things have changed. It's more the trend we've seen with the Delta variant is that the breakthrough cases are somewhat between 30 and 40% over the last 2 weeks. So if you throw those into the macro, the percentage is still under 1%, but recently the Delta variant is much more contagious for the vaccinated. I think Dr. Gupta alluded to the fact, the positive news is that the symptoms are mild for the most part, and the rate of hospitalization is less.
And for reinstating the quarantine for those symptomatic folks who are awaiting a test result, is that 10 or 14 days, the quarantine?
So what that is that's 2 different quarantines. What it is, Adrian, is that if you get a test today, you're just quarantined until you get your result. If you get your result and you're negative, there is no quarantine. But if you get a positive, then you'll have, from the onset of symptoms is when your quarantine period would go back to.
So circling back to the fair, given that localized control, you sort of talked about the roller coaster nature of where the data can go. We have seen the data go up, at least modestly, in recent weeks. The fair is only 11 days out. What has the county identified as a deadline and a threshold for at which point something will change, and what do those mitigation efforts?
As soon as we've made that final decision, I'll let you know. Again, we've had conversations where we know what we'd like to see. As that process unfolds, we'll give the public ample time on what any changes to the guidance are. We're just not prepared to talk about that today.
11 days out?
Correct.
Can you share any of those mitigation?
Yeah, we'll get more in specifics, but for the main part, I think you're talking about an outdoor event. I understand the anxiety behind the fact that you're going to have that many people together on a campus and that many people together, potentially with many unvaccinated. I understand that anxiety. We've prepared all of this into what we would like to see happen. And again, we're having conversations. The public will have ample time to respond before opening day of the fair.
And you said it yourself, County Executive, but we can maybe anticipate that these next couple weeks, few days will be shaky when it comes to a rise in cases. We saw that this weekend.
Yep.
So are there any updates to mask mandates or policies other than what you've said? Is there maybe a countywide mask mandate?
Not today. I think, again, for the most part, we discount what people have learned and families have learned. Many people are wearing masks because they know that's the right thing to do. To put a mandate also suggests and assumes that you can enforce the mandate. It's different when you have targeted mandates based off of targeted data coming from where you have fires and you put mandates there because you can enforce that. To suggest that we're in a position where we can enforce a mask mandate in a community with the dozens of miles that we have and over 500,000 people in and out of the county each day, that's not realistic. Beforehand, remember, you had the state setting the policy and saying to local governments, go enforce it. That wasn't realistic. And I said that many times. Again, the data for us, most epidemiologists, the models show for us another 2 weeks of elevated cases at least. We were putting in targeted mitigation to address that. We certainly are taking into looking at larger events where there's more people, where there's more risk with targeted mitigation there. But the overall risk to the community is not at the point where you put in mandates that you would then have to rearrange your ability to enforce it. People should wear the masks when they're in settings where there's lots of people, specifically indoors. We've said that. We've highly recommended it for people who are most at risk. And where we put in targeted mitigation, it's because we have data to show that that's necessary.
On Governor Cuomo and the allegations, do you believe, 2 questions. One is, do you believe the women? And 2, do you feel state is affecting their ability to effectively work with you on Onondaga County issues?
I think there's ample evidence through the Attorney General's report to suggest that the events that were described by the 11 women were accurate. So I think that report has ample evidence. So yes, I do believe them. And secondly, certainly as county executives, we work together very closely. We've been the front lines for this pandemic and the response certainly as well. And our association came out last week saying that in the interest of the state, now would be the right time for the governor to move on so that we can get back to work.
Circling back to the masks, do you think businesses or private-owned companies that they should instate a mask mandate for their employees?
Yeah,
I guess where do you stand with
yeah,
that?
they should, that's the right, and they should consider all the factors that I considered with our operation. When there's more spread, there is a better likelihood that you could have within your own building, right? Now you're talking about all your employees. You could talk about losing employees to quarantine. You could talk about losing employees to a period of time because they're sick. So these are all factors that the businesses need to take into consideration when it comes to mask wearing. It's a risk mitigation tool. It's not perfect. Depending on what the mask is, some are much more effective than others, but that's a risk mitigation tool that businesses should look at. And again, if we had broad-based data that showed things were on fire, things are not on fire, then we would look more at transforming our whole government's operation to be able to enforce a broad-scale mandate. But right now, that's not what the data shows us.
Cases this weekend, where are most coming from? Do we have that data?
Dr. Gupta's team is starting to develop cluster reports again, but basically you have community spread. When you have people going from gathering to gathering, especially indoors, you're going to see things come up. It's a more contagious variant, and that's what you're seeing. Then you're seeing, once you have it in the household, you're seeing household contacts. The household contacts last week were about 30 to 40%. The 3-day average, Dr. Gupta just told me over the weekend, was about 20%. So that shows you that there's more cases out in the community over the weekend than what there had been.
Any insight to the school conversations, the school guidance that will be released later this week?
Yeah, we'll build off the principles that worked last year. So when you look at the screening to go into the buildings was highly effective with the temperature checks and that. When you look at Dr. Gupta and her team did a great job of using the data to make policies to make in-person learning really doable with how kids get to school, with the buses, what the guidance is for the buses. Certainly the 3 feet will be something that is looked at again. Some of the other issues related to masking and whatnot, the health department's still working on specific guidance to specific circumstances on the ground.
Do you also give guidance on remote learning?
At this point, we will look for feedback directly from the school district on that. We're not experts. That's in their. We're here to give public health guidance, not remote learning. Our opinion is very strong that we believe in-person learning is a must. Remember, this pandemic is a lot more than getting the virus. The mental health from this is such an issue, so much so that one of our large stimulus initiatives is to put mental health clinics in every school district in Onondaga County. When we look at suicide, when we look at addiction issues and opioid, that's where we thought we were going to be, quite honestly. 3 weeks ago, we thought we were going to be, and we're still going to do it, but we got to deal with Delta now. But the opioid epidemic is a real problem, and it's been exacerbated by this. So public health, again, when we're looking at everything, and we're looking at all the decisions we got to look at, it's not just about just this virus. It's about the impacts it has on everything. And so I think that's just, these aren't easy things to take into consideration with policy. You have to take it all in, you have to look at the data, and you have to find that balance. and we'll do it.
You stressed guidance. Are you going to be leaving it up to school districts ultimately? I know last week a couple of superintendents said that they were waiting for the state guidance. Obviously, that's not going to happen, but.
Yeah, it will be guidance. They'll have the final decision. We've had great partnerships with the districts throughout the pandemic. We've been through a lot together, and we'll give guidance, proper guidance, so that folks can have the best year possible with in-person learning. And we'll give, I think that's what our goal is. That's what their goal is. Understanding certain guidance. If you adopt certain guidance, there's more risk with that. Quarantines in schools are something that we've gotten really good at. And when there's certain protocols in the classroom, if you have a case, it's less disruptive than if certain protocols weren't in the classroom and you have a case. It's quite disruptive, right? So these are all things that we're going to work through. We'll put out comprehensive guidance later on this week, and then the districts will look at it, take it, or maybe they want to do some other things.
Is there anyone that you're speaking to specifically at the state as it pertains to the fair? Is this the DOH? Is it?
Yeah, so I'm going to keep my conversations private with the state, but we're talking to the right people, and we'll again. I think we'll have more news on that. You love the fair questions, don't you? I think you got me like 2 weeks going now. You're really good at the fair questions.
Yeah, and it was exactly. I mean, it's bringing hundreds of thousands of people to Central New York. That's taking into account data from outside of Onondaga County.
Correct.
Well. What does On Fire look like when you point to we're not in that emergency situation?
On fire is when we had 300 people in a hospital and we had to take everything we did in county government and turn them into case investigators, and 400, 500 cases a day. That's on fire. That's a real problem.
Have you identified a point between here and now to prevent getting to On Fire?
We're not going to get to On Fire. We're putting in mitigation where we see it happening, and again, as the risk gets greater, the mitigation gets greater.
And is a mask mandate on the table? I know that
everything's on the table. Every tool we have in government, knowing that government didn't beat this last time, though. I didn't beat this last time. It was giving out good guidance based off of what we saw on the ground, and then the people in the public acting and changing their behavior when it merited it. So we'll continue to do that, but the community won this fight and won it quite quickly earlier in 2021 when we had real problems. And so the best tool we have, and this is what's changed, why I say it's not going to happen like that again. What's changed is we've vaccinated 77% of residents 18 years and above. What's changed is we have vaccinated between 65 and 68% of our overall population and continue to do so. So that's the big thing that's changed, and we need to continue to do that. If you want to look at our data, compare it to a state that has a less vaccination rate, go look at Missouri, go look at some of these other states. That's what On Fire looks like. And what's the difference between the two of us? It's the fact that we've been vaccinating and vaccinated in high percentages. So when we talk about the vaccine, that's how important it is the data tells the story, why the Delta hasn't hit us the same way it's hit these other communities, why we have 29 hospitalizations when other communities' hospitals are shutting down, and is because we vaccinated so much. What Dr. Gupta's point is the best way to end the variants is more people to get the shot. And that's what we're encouraging, and that's the tool to end this whole process, is continue to get vaccinated. At some point, when the CDC and the FDA says it's time for boosters, we'll start giving boosters.
I have a question for you or for Dr. Gupta about teachers and getting vaccines. Do you have advice for teachers who are reluctant to get them when they're going to be around little kids who can't be vaccinated?
Dr. Gupta, you're the doctor.
So teachers can get vaccines at this point, right? They are eligible, while kids under 12 can't. So it's it's very important to anyone who is eligible to get the vaccine, not only to protect themselves from getting COVID and also reduce the chance of creating more mutant viruses around us to create problems, but also to protect who may not have the best response, especially those who are immunosuppressed. Even among those kids, even the kids who actually can get vaccine, if they have transplant, if they have some significant underlying problems, teachers are there spending hours and hours with the kids. And it is really important for them to not only because of health point of view, but they also become like role models for the kids to make sure that they can continue to educate the kids. It's not like anybody imposing, it's a parental discretion and when their kids are eligible, but creating that safe environment so that kids, along with the mask, along with the physical distancing somewhere, within the school premises, they are providing this very safe environment for the kids learning so kids can continue to come and get the best education they can. It's good for their academic improvement and also for their mental health, along with the physical health. So I would hope that every teacher will get it. Thank you.
Question for either the county executive or Dr. Gupta. In Cayuga County over the weekend, the health department there released that there were 5 different exposures at 5 different daycares, either shutting down partially or shutting down entirely. Is that something that has been a concern here in Onondaga County? Has there been a lot of exposures in daycare centers? If so, I guess what's the mitigation process there?
Yeah, I think we haven't seen that yet at this point. And I believe in some of these facilities you still have mask wearing and other mitigation techniques, but again, we need our friends in Cayuga County to do well and to look at, when we look at vaccination rates between the 2 counties too, you see a difference, right? So that matters when you're talking about this. Again, the best way, as a father, the best way I can make sure my kids are okay is, I got vaccinated. My son Jack's been vaccinated. My daughter Maddie at some point in 2022 will get her shot, but maybe even before then if they're allowed to. But the kids, as adults, we want these kids to have a great school year. We want these kids to be able to be involved in the arts and play sports, and we want it to be normal. We want it to be post-pandemic. My 5-year-old doesn't even know what life is like to be with people without a mask on, right? This is sad. This is a state of time. But as parents, the best way to kind of to protect these kids while we get to that point where we can get back to where things were is to get the vaccine. And it just that these household contacts, when we look at them and we talk about them, a lot of them are children, and they're getting it from a loved one. We're very lucky that the children haven't gotten as sick for the most part. But the vaccine's the tool here, folks. It's the tool. If there was another tool and to end this thing, we would do it and we would use it right away.
Not sure if you can disclose this, but in terms of the school guidance, is it going to be encouraged that students and staff wear masks at all times?
It will certainly be mask wearing in schools will be part of the guidance. And it's not as simple as just yes, wear it or don't wear it. You have to look at the facts on the ground in the community as well. And so that certainly will be part of the comprehensive guidance that comes out. Any other questions? It's Justin's birthday today. Justin says that's why we had a press conference too. Just kidding, Justin. But again, thanks, folks.